Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is John. John is an administrative fellow at the Children's Hospital in Wisconsin. John, please introduce yourself.
Yeah, thanks so much. So, as Cole mentioned, my name is John Smith-Wiehe. I am the second year administrative fellow at Children's Wisconsin. Children's Wisconsin is the only freestanding independent pediatric institution in Wisconsin, and we are the only organization fully dedicated to the health and well being of kids in Wisconsin. Obviously, we have lots of partners in that, but that is our chief mission, and we're solitary in that in the state.
We're so happy to have you here. You have a huge wealth of experience. I'm going to just kind of dive in right away. I wanted to ask, I noticed that you were the co-chair of a program associated with the Children's Miracle Network back in 2013. So that would be during your undergraduate years. Did you identify that you wanted to work with children back during your undergraduate, or was it something that you kind of stumbled into? What did that look like?
Yeah, good question. So it actually goes back all the way to my very first days around. So I was a kid in the hospital. I had a 2 week NICU stay, a couple of surgeries before the age of 5, and then some post surgical complications that kept me in and out of the hospital, even through elementary school. So working with kids and specifically with kids' healthcare has been a goal of mine since I graduated high school. I actually started my undergrad anticipating to do healthcare administration and got a little bit knocked off that path through some coursework that I was doing around neuroscience. And I thought that that meant that my path in healthcare was over. But at the same time, started working with, as you mentioned, with Children's Miracle Network. So if if folks don't know, Children's Miracle Network is a national organization that raises money for children's hospitals. They have some college programming. It's called Dance Marathon. Myself and a friend of mine were the co-chairs of that while I was in undergrad. We put on a fundraising activity, um, 12 hours, where folks pledged to stay on their feet and raise money at that time for Sanford Children's in Fargo, North Dakota.
That's excellent. And what great experience as well. I mean, and so your experience actually is very interesting just in general, looking at your resume, because you had a 5 year gap between, your undergrad and grad. Not only did you already have impactful experiences during undergrad, but then you have this 5 year gap where you're working with Epic Cupid. Not a lot of people will probably know exactly what module of Epic that is. So can you explain what that is, and then specifically what projects you worked on while at Epic?
Yeah, definitely. So yeah, I worked at Epic as a project manager doing implementation for Cupid, which is Epic's procedural cardiology application. What that means is if you ever have an interaction with a cardiologist where they're taking images of your heart or doing a stress test, or if you're working in the cath lab or the echo lab, or excuse me, EP lab, that was the software that I was working with. So that module of Epic integrated with other pieces of software in order to get all of that data into Epic, and then set up the text nurses and cardiologists to do their documentation associated with that care. At that, through those experiences, some of the projects that I worked on were large health system projects in Louisiana with Franciscan Missionaries of Our Lady Health System. I also had the opportunity to do some work with Cleveland Clinic out in London. Actually, spent some time with them trying to localize our processes to the London market. I had the opportunity to work with Mayo Clinic on their first upgrade after they had implemented. And then the last project that I was on before I ended up taking the grad program route was with RWJ Barnabas out in New Jersey. Those are a couple of the big projects. I was able to work on some other things here and there, but I think those are some of the big ones that really shaped my experience working there, and a lot of the relationships that I had and still have came from working on those projects.
Well, so you still have these relationships, 5, 10 years down the road.
Yeah, definitely. Especially from that first project, a lot of the people that I was working on down in Louisiana were in a similar position as me, from both their legitimate position at Epic as well as it was their first role out of either undergrad or grad school. So we're in very similar stages of life. Had the opportunity recently to go to a couple of their weddings. They came to mine, and actually quite a few of my um quite a few of my friends now that I haven't been there that are still from there are my wife's friends that she made while she was working at Epic. So definitely great experience both from a professional and personal perspective.
That's excellent. Did you meet your wife at Epic?
Yeah, we actually met in Louisiana on a work trip. We didn't work together, but she was coming down to help out a mutual friend, and that mutual friend played matchmaker a little bit for us. So here we are, 7-ish years later. So lots of lots of good things came out of that time in my
Oh,
life.
congratulations on all of that. That's incredible and very important for our early kind of careers to be attuned to how important those relationships are. Why did you leave Epic? If you can, don't mind me asking. It seems like
Yeah,
that'd be a large salary cut going from essentially, whatever it was to zero and doing the MHA program. What drove you to do that?
yeah, definitely. So I think going back to when I was in undergrad and had that desire to do healthcare administration and sort of took a detour from that. It was still something that I was interested in, and specifically pediatric healthcare because of those experiences that I had when I was a kid. So the desire to go to grad school was both from a I wanted to maybe leave healthcare IT as specifically as that was, and broaden some of the work that I was doing. I also wanted to get out of some of the vendor relationship and get a little bit closer to the delivery. So while being the vendor and having those relationships and building those close relationships with IT team and some of the clinicians was great. Those relationships really only were, could be 9 months. Longest, I think, was maybe 2 years. And so that impact that you have is really brief and it's really large, but then it can fall away. And so one of the goals of going to grad school is and getting the MHA degree and then the fellowship was to be able to build some of those longer term relationships and have some of that longer impact in one specific focused organization. So I'll be honest though, I mean, salary was a component of that. I did have the opportunity to work in grad school. I also did a little bit of consulting while I was in grad school just to have some income. Um, but it was really the alignment with pediatric healthcare that was driving me to make that career change.
That makes a lot of sense. So it really wasn't necessarily a shift for you then. And so you went through your MHA program. It seems like you did well there. I noticed in the MHA program, you got the the residency, the administrative residency at Intermountain Healthcare, but specifically with the Children's Hospital. I want to ask, was it challenging? Was it competitive to get that residency at that specific location?
That's my understanding. Yeah, one of the great things about Intermountain is they take 14 administrative residents each year, or at least they did the year that I was there, and you're placed specifically in one of their hospitals or one of their regions. And so I had applied specifically to work with their children's hospital, primary children's, because of the interest in pediatric health. And my understanding is it was competitive. I was um, really lucky that that was where I was able to do that administrative residency, partially because my sister in law and her husband lived in Salt Lake City and still do. And so I was able to spend time with them while I was there, which was also a huge draw for me to be able to spend, okay, if I'm going to spend 12 weeks somewhere, can I spend some time with my family as well? So that was great, incredible experience working with primary children's. Uh, one of the projects that I worked on while I was there was taking a look at transition of healthcare, actually from a pediatric institution to adult healthcare, and some of the challenges that patients and families feel when they're going through that. So the project that I worked on was proposing a programmatic approach to that with a lot of support from Intermountain, as well as at Primary Children's, they partner with the University of Utah, and so it was a good collaborative experience across that institution and seeking to find ways to help kids get the care that they need when they are no longer kids. And so It's a fairly sizable gap right now in the services that patients and their families experience when they're being seen by a pediatric institution versus a institution that is uh, focused on kids and adults. It can be pretty different. And there's some hesitation even on the adult provider side to caring for some of these conditions that kids are bringing with them from childhood. And so trying to make those bridges was really a key component. So great experience with primary children's. Really grateful for the opportunity to spend my summer there. And the other component of that, I'll just be vulnerable here, is, I'd had this goal of working with pediatric healthcare since I was basically 17 or 18. And at that time that I was there, I was, a little bit older. Maybe I think I must have been 27. I wanted to see if I could hack it, basically. It was so personal to me, right? Such a large part of my life growing up to be a kid in the hospital, have the surgeries, have inpatient stays, that I wanted to make sure I could go, and that emotion that I was able to feel it and be connected to the work, but also not let it overwhelm me. And I was really grateful for that opportunity in that more contained experience of, this is 12 weeks. You're going to get thrown in. It's going to be potentially intense, but as a precursor to then what I was looking for in my fellowships or in the fellowship process. So really grateful for that experience, for giving me that lens and that contained experience to process some of that from a personal perspective.
Definitely. And seeing where you are now, I'm assuming it went well.
Yeah, definitely. And it gave me a confidence that, yes, this is personal to me, but that's not a bad thing. That can be a really good thing as well. And so my time now, obviously, with Children's Wisconsin, I'm in the pediatric healthcare world, and planning to continue to be in that space moving forward. So it went really well. There were some hard moments. There are still hard moments, right? But I think uh, those can be important moments too.
With that transition project that you worked on, it is interesting because I remember when I worked in neurology, we would have lots of young people who, even before 18, they would have to transition out of CHOP. And then, especially the more severe cases, then they would have to come to our neurology clinic. And it really was mostly centered around adults. And it's interesting. Some of the, like one of the older neurologists who'd been around for many years, he was the one who saw most of the children. He was really good at fixing these issues, but it was different. Like none of the staff was used to it. And I know people think it's simple, but it's things like, our wheelchairs and our chairs in the like everything is very, it's just very different. And when you go to somewhere like CHOP, or I'm assuming at the children's hospital you work at now, everything is much more centered around children, and not just children, but also their parents, their families.
Yeah, I think that's a key differentiator, right? Both legally, but also in the sort of day to day management of the diseases or situations or whatever else the patient and their family may be coming to seek services for. The parent is a huge component in that. And I think that's, it's interesting. I think about even my parents right now and their parents. They're a huge part of the care for their parents now as their
Mm.
parents are advancing in age. And so it doesn't really ever go away, I don't think, but the focus on it, and this may be forced by the fact that it's a legal thing, right? Is that kids are not their own guardian. There's a different relationship there in information sharing and those components. But I think patients are never just themselves, right? They exist within that larger infrastructure, and that really starts at the family level. We just see it a little bit more specifically, especially if you're caring for a 3-year-old, because a 3-year-old can't care for themselves. So definitely but all of those other components, right? Whether it's developmental or different ways that even drugs or treatments interact with kids is different because they're not just little adults, they're kids, right? So
Mm-hmm.
their bodies are different, their anatomy is different, right? And how their anatomy um, and anatomy and physiology, there we go, got there, changes how we treat them as well. So it's not just the context, right, but it's also legitimately different
Mhm.
in their treatment.
And it's hard to know that unless you've kind of, I guess, been in a situation like yourself and then had that experience. Because, from my perspective, I mean, I wasn't in the hospital a lot as a kid really at all. And then now I'm an adult and I don't have children yet. I was originally a pre med, several hundred shadowing hours. When it comes to pediatric, it's like, oh my goodness, it's going to be a nightmare because it's going to be all different numbers, all different. And it's like, you can't, like you're saying, you can't just reduce it mathematically. It's like, oh, this is a completely different ratio we're using. And the physiological reasons aren't what you'd expect. It's
Right.
so it is really like I would complain to my wife. I'd say, "Oh, we have a pediatric thing we're shadowing, so I'm not going to be able to guess any of the answers." Yeah, so it's very different. And then so you went through your residency and you worked on great projects, and then you go to the fellowship. What was that application process like? Was it really like an anxiety ridden, or how did that go?
Yeah, one of the things that was important to me and my wife now was not only my career but her career as well, and so and our community. So I primarily applied to residency, or excuse me, fellowships um, based on location, as well as based on uh, their what kind of institutions they were. So Children's Wisconsin was my top choice because it was the pediatric institution, was and is the pediatric institution in Wisconsin, and Wisconsin is where we wanted to be for our life. And so the anxiety was, if this is my top choice and it is the choice that checks all of the boxes, if it's not where I end up going, what am I going to do? And so I had applied to some other institutions in Wisconsin, you know, considering not only my what I wanted to do, but what we wanted to do, and am grateful for those experiences. But am really grateful that I was able to land at Children's Wisconsin. I'll say, one of the things that I think can be really challenging in those experiences is feeling like you're competing with your friends, right, or peers. And I know that some of my peers from the University of Minnesota grad program, they would go to interviews and it would be people from our program who would be sitting there with them, or going through the exact same experiences, and that can be anxiety inducing because you know them well through coursework or other components. I was lucky in a way in that from what I know, I did not have other people competing from within my own program for the Children's Wisconsin Fellowship. I know I had applied alongside some others to some other programs that I applied to, but I think that can be challenging to navigate those social dynamics, and definitely anxiety inducing. I'll say though, generally one of the things that I considered a lot was whether or not I was going to even do a fellowship, given some of my work experience and some of that I felt like I could draw from in order to have the next role out of grad school. That it was definitely, it was something I wanted to do, but it didn't feel like the only option that I had, which I think helped frame my experience as I was going through it. And I think that's important. I'll advocate for people doing a fellowship. Obviously, I've been in a 2-year one. Experience has been great. I've been exposed to so many different projects. I think if that's not a path that somebody's comfortable with, I think that's also totally legitimate and something that we can encourage people to do as well, especially given whatever their background may be or whatever their interests may be, because those are varied.
I want to ask, do you think it was worth it going through the fellowship considering your experience?
I do, because I wanted to change career paths, right? I didn't want to be just in healthcare IT or in, doing epic work for the rest of my career. And so I think the experiences that I have gained through this have allowed me to sort of pivot in different ways. That being said, I think the organization Children's Wisconsin is has been so supportive in me exploring those different areas, but very frequently those skills are asked to be drawn on because they're either unique or the project management components of that are needed in any sort of work that you're doing, that I find myself drawing on those experiences frequently, in ways that are really good. And I don't think I don't think I could be doing the work that I'm going to be doing or hoping to be doing without the fellowship experience, mostly because of the relationships that I've built and the being able to navigate. I'll just give the example here. The merch that I have is from
Yeah.
a Milwaukee campus improvement project, and specifically a project I worked on to help activate and transition into the new Skywalk building on campus. That has nothing to do with healthcare IT, right? But it is project management and change management and relationship building and staying organized and being tenacious, which are all things that I did at Epic, but in the under the guise of healthcare IT implementation, right? That experience and the success that I was able to achieve through that um, has helped set me up to then craft some new a new path in children's and not just step into maybe something that already existed because I was able to have that new experience and draw on the previous experiences that I had. So definitely valuable. I think if somebody is I know people at Children's who have been in their careers, maybe in the lab or in the pharmacy, and they're interested in continuing in the lab or in the pharmacy, and they're pursuing or have completed their MHA. I'm not sure that a fellowship would help with those specific situations, right? They have that specific career expertise already, and they're getting that degree to sort of round out some of the areas that maybe they haven't been exposed to, but they're sticking, right? They have their path, they're passionate about that, they have that expertise. I think that's incredible, and I'd encourage them to stick in that way. I've also given feedback to people even in the last couple of weeks of if you don't want to stay in, we call it, whenever we draw for just a generic example, we call it the toe clinic. If you don't want to stay in the toe clinic, I think a fellowship is a great opportunity.
Mm. That's extremely valuable. Actually, that's exactly what I was going to ask you next, anyways. And you had answered it as how you draw on past experiences and then about that transition. But thank you so much for joining with us. Couldn't be more appreciative. These are great insights. Our audience is going to really enjoy this.
Yeah, well, happy to be a part of the conversation. If folks are interested in connecting on LinkedIn or otherwise, and are interested in chatting about pediatric health, healthcare in general, or even just the experiences that I've had going from sort of industry to grad school and then
Yeah,
into nonprofit. Happy to talk about that as
I'm
well.
sure they will. We'll definitely have your LinkedIn attached to this because I'm sure people would love to connect with you.
Awesome. Well, Cole, thank you so much for setting this up. Really appreciate it. And yeah, looking forward to further conversations in the future.
Yeah, thank you.